From WXOJLP Northampton, 103.3 FM, your Valley Free radio station. Welcome. I'm Warren Odess Gillette, and this is A Baha'i Perspective. A Baha'i Perspective is a radio program that presents a Baha'i perspective on life through interviews. If you want information specifically on the Baha'i faith, you're welcome to visit the website www.baha'i.org. That's BAHAI.org. Or you can call the toll-free number 1-800-22-UNITE. Today I'm playing a telephone interview with Bahman Payman, a Baha'i from Iran who came to the United States to finish his medical schooling. After completing his schooling, he returned to Iran and worked at a Baha'i hospital called Red Lion Society. When the Khomeini regime took over, they confiscated the hospital, assassinated the chief of staff, Dr. Hakim, and arrested or killed other Baha'i physicians working there. Bahman and his family happened to be in the U.S. when this happened, so he stayed in the U.S. and practiced medicine here. He's now retired and is volunteering for two Baha'i-inspired institutions, Health for Humanity and the Tahirih Justice Center. I started the interview by asking Bahman where he grew up and what was it like growing up there.
I grew up I was born in Isfahan, Iran, and I was raised in Yazd, which is the central part of Iran. And after graduation from high school, I went to the medical school in Tehran, which is the capital of Iran. Mm-hmm. And I had 7 years straight medical school after, of course, passing a very competitive exam. And then I passed another exam to come to America after I served my military in Iran, and I came to the United States and had my training. This was back in 1967, and then I went back. I had my training in Pittsburgh, Pennsylvania. I became a specialist in obstetrics and gynecology. And then I went back to Iran, and I was practicing first in Kermanshah, Iran, close to the Iraq border. And then I came back to Tehran and worked in the Baha'i hospital, which the name was Misaghiya General Hospital. And after revolution, or right before the revolution, I came back to the United States and started my practice in West Virginia, and then I moved to Virginia, retiring here in Virginia now.
Mm-hmm. What was life like in Yazd?
Oh, Yazd is a very conservative town, and the people are very religious in each group of religions. Of course, the majority in all of these towns and cities in Iran are Muslim, Shia Muslim, and very religious city Yazd is, and was, and still is, and very prejudiced against the minority, which I was born in a family of my father was Baha'i, the second generation Baha'i, and my mother was Zoroastrian, and she passed away now, and she stayed Zoroastrian all through her life.
Mm-hmm. Now, how is it that your family became Baha'i?
Right, my grandfather, with the same name as Bahman, became Baha'i with 3 other Zoroastrian merchants in the city of Qom, which is holy city for Muslim people. So my father was Baha'i, and I grew up in the culture of religions of Baha'is and Zoroastrian, because all of my maternal family and relatives were Zoroastrian and very strict. My father's side were Baha'is, they were all Baha'is, and again strict. So, but I was raised in both religions and cultures, and after become age 15, I decided to sign a paper to become a Baha'i, because I realized that signing this paper, I am not denying Zoroaster as a prophet, and I progressed to the Baha'i faith, which Baha'u'llah was the promised one of Zoroastrian people, as it was for Muslims. So by becoming Baha'i, I accepted all the divine prophets of God, so I stayed Baha'i.
Mm-hmm. How did your mom feel about you?
She didn't have enough. She didn't have any objection for me becoming Baha'i at all, and she would let us go to the Baha'i gathering and classes, and actually she was reminding us tonight or today is the day to go to this and that.
Mm-hmm.
She was always supportive.
I see. Now, did you experience any persecution yourself while you were in Yazd?
In Yazd, as I mentioned, the people are very prejudiced in that particular town. And during my elementary school, I remember some of them, my classmates, always making fun of being Baha'i and stone to us and throw stone at us on the way to the school and passing the curse word and other things. And actually that was a time one of the mullahs went against Baha'is, and some of the Baha'is' shops and houses were confiscated and burned, and not execution but persecution was going on till this revolution came, and then 9 members of the local spiritual assembly of the Baha'is were all martyred. And before that, in the past, they were in 2 times of 2 span of maybe 10, 20 years between, they executed 7 members of the Baha'i faith in the past. That was the 3rd. I said 9 member, it was 7 member again. That was, I made a mistake. The last one after revolution was 7 member of the LSA, which was, that was the last one, and they were executed. And persecutions been all the time and still going on.
You went to university?
Yes, I went to Tehran Medical School. Over there, we don't have a college. We have college, but for medical school, we don't have. We pass a competitive exam, and after that, we go to medical school for 7 straight years. So we don't have pre-med college. So if we accept, or if we pass that exam and accepted to the medical school, we are in a medical school, and 7 years later we become a physician, general MD, and then if we want to come to America, which most of the people wanted to, and I was amongst them too, we have to pass an exam, English exam and medical exam both, to be accepted to have a training here in the United States.
And where did you go to med school in the United States?
To residency program mainly. We have to repeat, at the time I came, we had to repeat 1 year internship. We already had 2 years internship back home. We had to repeat 1 year internship now. At the time I came back in 1967, I had repeated 1 year of internship, and then I applied for residency and specialty training, which I went to the hospital in Pittsburgh. I had my internship in New York, Flushing, New York, and then I went to Pittsburgh, Pennsylvania, to one of the affiliated hospitals to the university to have my specialty training in obstetrics and gynecology.
So when you arrived in Flushing, New York to do your internship, what was your first reaction to arriving to the United States?
Well, I always had a dream to come, especially New York, and I was with one of my Muslim friends, a very close friend, so we both arrived there. Before that, we had a stop in England and in London, England, and then over there we had some problem with language, which I remember vividly. We wanted water when we went to the restaurant, and they couldn't understand what we wanted, and I had to go to the kitchen and show them the faucet, and then they brought us the water. And we were so disappointed by that. And then, of course, in America, we haven't had that problem as much as we had in Europe. Then we were separated. He was going to Pennsylvania, and I was coming to Flushing, so I had a shorter way to come and get accommodation. And I was very impressed by the facility in the hospital that I used. I was with one Korean doctor in one room for a few nights, and then I selected my room, private room. In the same hospital, they had a sleeping quarter, and we had, as an intern, we had a sleeping quarter close to the hospital, which was very unique because we, back home in Iran, we never had this facility at that time. And it was very convenient. At the same time, you are close to the hospital. You don't have to waste your time for traffic and driving and finding the parking place and this and that. Mm-hmm. So it was I was very impressed from the first time I came to the United States. Very good memory, and I got married actually in Flushing, New York too.
Oh, really? Soon
2 months after I arrived.
Uh-huh. To someone you knew from Iran?
That is right. My present wife. We are together for 38 years. And, my daughter, first child, was born in Pittsburgh, Pennsylvania. Mm-hmm. And my second child was born in Kermanshah, Iran, when we went back. And I was serving in a Red Lion Society hospital in Kermanshah, Iran, close to Iraq border.
Yeah. So did your wife follow you to the United States?
That is right. I knew her family, and it was, I decided to get married. I was getting old, and I thought, would be to my best to get married. So I wrote to my parents. And in the Baha'i faith, we have to have a permission of our parents. So she had the same thing, so we got the permission, and then she came to the United States. We got married in Flushing, New York in February of 1968.
Mm-hmm. Was the student body diverse when you did your internship in Flushing?
And that was another thing I like, as I mentioned, The first night I was with a Korean doctor in one room, and we exchanged some ideas about our countries and other things. And the group itself, New York is the most diverse city I ever seen. I think still is, is very diverse. And I'm glad I selected New York as my internship. And I enjoyed my 1 year over there, and still sometimes for vacation and medical education, I rather to go to New York than any other place if I could go.
Mm-hmm.
So, yes, it was very diverse in the hospital, in the public, and Manhattan is never die. Actually life starts at night over there.
Mm-hmm.
Of course, at the time, we were working hard every other night on call in a busy hospital. Of course, now the things are different. They realize that more rest you give to your doctors and interns and residents, the patients get better care. So now there are some more regulations not to work as hard
Mm-hmm.
or doctors hard. So they have every maybe second night or third night on call. But at that time, we had to cover the hospital, emergency room, wards, floors, OR, ER, every other night on call for when we were interns. And for my residency, again, because I was in the field of OBGYN, I had to work every other night also. But we learned at the same time, too, just working hard and learning more. And
Mm-hmm.
that's the way it was. But now it's a little bit different towards less on call and more rest and more patient care than before.
Mm-hmm. Did you find that you had different experiences as an intern in the United States versus your medical experiences in Iran as an intern?
Yeah, but we were, as I mentioned, we were working harder here every other night. Over there, when we were on call, we didn't have to get up for starting IVs for the patient. Here they had a special, now they have a special team of nurses that they do that for
Mm-hmm.
us. But back in 1967, we had to get up to start the IV or sometimes the medications on the patients and blood transfusions. We have to start the blood transfusions. Now they have a special team of nurses, very well educated nurses, that they do that for us, and we have to just, these days the intern just get up when there is a serious problem or there is a need for MD rather than a nurse. And compared to Iran back in 1967, it was pretty much the same in both places, but the life was more relaxed back home than here. And the nurses, sometimes they would do some of the job at the middle of night rather than calling us. And the hospital would approve that here, with the more stricter regulations, we couldn't do that. So it was harder. But at the same time, as I mentioned before, we learned a lot from those small, even IVs. This is a small job for a medical doctor. But we got some experience, and some. It's not fun to get up at middle of night for starting IV, which the nurses, most of them are, if not better, they are capable to do that.
Right.
And they will do that now, but back in 1967, we had to stop this. And something I remember vividly, one occasion that in New York, when the patient needs laxative, they said the patient needs physics. And we had to do a physical history and physical on every admission we got when we were where we were on call. So that we would go and do it without that the patient could not be admitted, and the attending physician next morning would be mad if we wouldn't take the history and physical of that admission, which was usually emergency. So one night when I was new, the nurse called me, this patient needs physics. I said, I just did her history and physical. He said, no, doctor, she needs a physics. And, when we are new here, and I didn't know. So I got up and I went to prove to her that I did her physical exam and wrote the history and physics. And the nurse says, oh, I meant she needs physics. She needs laxative. So I learned the
jargon.
New York, instead of laxative, they call physics.
Oh, okay. I didn't even know that.
For my friend happened to see, they call ICU. This was very unusual for us, intensive care unit, to call ICU. And this friend of mine says, no, I'm married. I don't want to see something like that. It was funny, the language.
Sure.
Sometimes a barrier. This friend of mine was married, and he was intern, and this nurse says, where is the patient? Where do you want me to come? He says, I see you. I said, no, I'm a married man. I don't want to see you. But she meant I see you. So this was vivid things that I remember, and every doctor has something like this in language. First few months we had this problem, but later on we enjoyed working with all of this. Even broken language, I still have Pinglish accent, you can tell. I call it Pinglish. Translation of Persian and English. So,
yeah.
That was fun to work with the diverse people, nurses, doctors,
right.
And at the same time learn about their cultures, medicine, and other aspects of their culture.
Right. So why did you have to leave Flushing?
Oh, because we have to repeat only 1 year internship, and then we have to get to the residency program. 1 year is mandatory repetition. Now it's not that way, but they go straight to the desired residency program. So I wanted to have OBGYN, and I heard I was lucky to get to this program because some of my friends from Iran were graduating from that hospital in Pittsburgh. So, and I was lucky to get interviewed by the chief of that department. He accepted me to become a resident, and I went with my wife to Pittsburgh, and my daughter was born there. So when I was in second year residency of OBGYN. So I voluntarily decided to go to Pittsburgh for residency.
And once you got your residency completed in Pittsburgh, what did you do?
Right. I went to close by West Virginia. I practiced OBGYN for 1 year, almost 1 year, and then due to some family, I had to go back to Iran. So we both went to Iran, and first I worked in Kermanshah, Iran, and then I came back to Tehran University and worked with my professor in Tehran University in that hospital, which was a Baha'i hospital. And after that was confiscated by the Khomeini regime, and they assassinated the chief of staff, who was Professor Hakim, who was the professor for most of the present doctors are practicing here in America. He was the very famous anatomopathologist, and he had a section in Riviera Anatomy book in France with his name, and he has several holes in the body by his name, Hakim holes. And so he was the chief of staff, and he was assassinated in Misawiya Hospital, actually in his office, which was next to the hospital, because of his religion. And other being a Baha'i, and friend of mine we were working in Kermanshah, who was by the name Dr. Talim. He was assassinated. He was they brought him from Kermanshah to Tehran, and he was OBGYN too, and he was assassinated. He was shot in Tehran. And another friend of mine who had a training in America, and we were classmates, by the name Dr. Sadegh, who was a psychiatrist, and a Baha'i. He was dismissed and apparently executed with kidnapped and dismissed, and with other 8 members of the NSA, National Spiritual Assembly of Iran, were dismissed and assumedly executed in Iran, and he was my classmate also, and because he was Baha'i, the only crime he did was because he was Baha'i, and the other one the same thing. And they all could deny their faith and become a very successful doctor or freed from everything, but they did not, and they were executed.
And what about you? Was your life in danger?
Yeah, if I would be there, being in the hospital. I left, my family came to the United States 3 months before the revolution, and I came a week before Shah left Iran. Otherwise, I would be having the same fate as the other friend of mine had, especially working in the Baha'i hospital in Tehran, Misawiya General Hospital. But the name is now Mustafa Khomeini Hospital. They confiscated the hospital and dismissed or executed Baha'i doctors and midwives and rest, and then they changed the name and executed the chief of staff, Professor Hakim, and some of the other members of the medical staff, which were Baha'i.
How many of you were able to escape to the United States?
Yeah, fortunately, I had my visa, and I would come here every year. I had that time they would call it green card, but now they call it blue card. I had that, and I had to come to the United States for renewal of that green card every year, and at the same time to update my knowledge in my field. So everything was okay, and I could come with no problem. But the only problem I had a busy practice in that very famous Baha'i hospital, so I had to find a doctor to cover me, and fortunately I had a Muslim friend, and he accepted to cover me, and I could leave, and I was coming to go back in 3 months, but now it's almost getting 30 years I'm still here. So
yeah,
that is my story.
So when you left, you were thinking you were going to come back, but then things just went...
The things you are hearing every day, executing this, that, things are not getting better, or getting worse.
Right.
And Baha'is' houses were confiscated, doctors are being executed. So I could go back, but I didn't know whether I could return in one piece or not at all.
Right.
So we just stayed, and of course, yeah.
What was the event or events that caused you to send your family away?
My children were going to the American school in Iran, and one day, this was the time the Shah was in power and everything yet, but my daughter said the driver of the bus told us to lay on the floor because someone might shoot you. I said, oh, this is a bad sign. And at that time, one of my friends was visiting Iran, and he said, Doctor, this is not a good sign, and let us go back all together to America. I said, I can't, but maybe my family. So I decided, or we all decided my family to come with my 2 children and my wife. A friend of mine came back to America 3 months before I came. And I'm glad a friend of mine, was advising us to do, and we listened to him. And then after that, every day they were burning buses, they were shooting at the school, and American school, and embassy, and then, the rest, what happened. That was...
Yeah.
So they came before me and then settled in Virginia. That friend of mine was in Virginia, and then the doctor, I was working in West Virginia before I went to Iran, so he told me to come and work with him again. So he settled in West Virginia, close to Pittsburgh, Pennsylvania, and then he decided to come back to Virginia, and now I'm retiring in Virginia.
Mm-hmm. So how long did you practice in West Virginia?
I practiced there once before I went to Iran, about a year, and then again when I came back for 2 years, or 2 years in one place and 5 years in another place in West Virginia, and then I moved to Virginia back in '86.
And why did you do that?
Because the situation with liability insurance was very high. We, as a OBGYN, they were asking in West Virginia to pay $150,000 yearly for just liability insurance to cover our malpractice, or now better wording is liability insurance. So, I couldn't afford to pay that, and the hospital, they were paying me my malpractice and liability insurance, and then I was on my own. I said, oh, you have a good practice, you can stay here. I said, not with this liability. With 180, 90, I was paying that, and then all of a sudden went up to $150,000. I said, $150,000.
Mm-hmm.
So then I decided to go to Virginia, which has a lower rate of liability insurance, and so that was the reason.
Mm-hmm. And how long did you practice in Virginia before retiring?
Yeah, since 80, I moved to Virginia in '86, and then for 20 years I practiced there, and then 3 years ago I retired.
Mm-hmm. So what are your plans for the future?
Well, I do some locum tenens, what we call temporary filling for doctors, that they go because some agency pays for my liability insurance, and wherever they need. Actually, last month I went to a place in Virginia and covered the physician, and the agency pays for liability insurance and pays daily rate, which is all right. But it's getting very competitive because lots of doctors are doing this now, especially OBGYN, due to the high cost of liability insurance again. But I'm semi-retired, you can call it semi-retired, doing this locum temporary job for filling for some doctors in the states where I'm having license, which is in West Virginia and Virginia.
Yeah.
And I do volunteer work for Native American in New Mexico. During the past 5 years, I've been doing that in summertime in Shiprock, New Mexico.
Mm-hmm.
I do volunteer 3 or 4 weeks in those hospitals, and the doctors could go on vacation, the other doctors. And health, I'm a member of Health for Humanity, which is a Baha'i organization. Both me and my wife are a member, and we do some volunteer work with them also.
And what kind of volunteer work do you do?
Just in my field, OBGYN, medically related to my field.
And you do
OBGYN, and my wife had a training of midwifery, so it's related field.
So it's in the Virginia area that you do this volunteer work with this organization?
No, wherever they need mainly is for abroad, but I haven't had a chance to work in abroad yet. But recently I received an invitation that in Virginia, even if I can work or see or check one patient or two patients a year, as they organize the special Tahirih Society or Tahirih Foundation for those molested and abused children from around the world, especially Africa. So I recently got an application to fill for that volunteer work in Virginia. But for Indian Health Reservation, because they are mainly governmental organization, we don't need a license. If we have one license in any state, we can practice in governmental hospital for a few months as a volunteer with no problem. So in Shiprock, New Mexico, which I go, I use my Virginia license or any other license is accepted in governmental hospital.
So you were referring to the Tahirih Justice Center in Washington?
Right, that is right. Yes, I just recently got invitation for that. Right.
So you think you'll take them up on going abroad shortly?
This was the one I received. This was mainly for Washington, D.C. area, Northern Virginia, which we are, hopefully we are trying to relocate there in Northern Virginia, Fairfax County.
Hopefully with Health for Humanity, you may travel abroad or work abroad or volunteer abroad.
That is right. You know, it is. We are a member, both me, my wife, and myself, and we make contribution for the organization. And now we can contribute as a, beside monetary, what we were doing now. Physically, we will be doing some medical helping wherever is needed.
Yeah. How do you see your life would have been different if you did not have the Baha'i perspective in what you do?
You know, I would be stuck mainly in my office and concerned about my income and not helping other people, not having any free visits, and thinking all in a group community I practice. But now I have a broader aspect of the medicine and thought of the thinking of the whole world, the problem of the world, rather than just one society. At the same time, I'm helping my own society and wherever I'm practicing. Now I already served. Now in my retirement, I could have broadened that and go to volunteer work wherever there is a need, which is plenty of places in America even. There is a need for. And work done in the spirit of service, this is a Baha'i belief, is considered worship. This was always my motto in life. Right?
Bahman, thank you very much.
Oh, I appreciate that, your time, and thank you.
Okay. I hope you enjoyed that interview with Bahman Payman. a Baha'i and retired physician who had to abandon his native country of Iran because of his religious beliefs. For a copy of this and other interviews, you can go to the website www.abahaiperspective.com. For information specifically on the Baha'i Faith, you can go to the website www.baha'i.org, or you can call the toll-free number 1-800-22-UNITE.